Hello, and welcome to another episode of the Many Faces of Cancer podcast. I am your host, Melissa Grosboll, and joining me today is Lauren Taylor. And Lauren is a native of Parker, Colorado, which is where I live as well. She's the owner and founder of Aesthetics 360 Lash and MedSpa. And she is actually in the process of going through treatment right now for breast cancer. And we have a lot to talk about today because she's got some amazing things that are going on in her spa. And I want to have her share it all with you. So, welcome to the show, Lauren.
Thank you. It's great to be here. Thank you for having me.
Absolutely. It is so great to have you on. And I heard some of your story on another podcast, and I was like, oh my gosh, I have got to get her on here to talk about all of that. So, from one fellow Parkerite to another.
I think Parker, right? Yeah.
Parkerite, I think. Yes. All right. So let's kind of get into your story. So you, like I said, you're still going through the whole process. So tell us a little bit about your diagnosis and like what was going on in your life and how was all of this found?
I was going through my life, I guess, as normal. I had just opened my med spa at the time. So very, I would say maybe 8, 9 months. I haven't done the math exactly, but very fresh at opening my medical spa. I also have an insurance brokerage. So I've been doing that for about 15 years. So I'm working with my insurance brokerage and opening this new business and kind of going through the ups and downs of a new industry for me and staffing and all the ins and outs of opening a business. And I had been on a weight loss journey for some time before opening my medical spa. And I decided to bring that service into my medical spa. So the medically assisted weight loss shots that everybody loves to talk about these days. I We offer those here, and I had been doing those prior. And with that, I lost 97 pounds. And
Congratulations.
yeah, that was it's like a whole nother person.
Yeah.
Um, but that allowed me to find my tumor. So everything kind of shrinks and gets smaller, and I noticed a lump in my breast. And one of the amazing nurses that works for me is not only an aesthetics nurse, but she's also an oncology nurse. She's done
Oh,
oncology
wow.
for almost 20 years. So
Okay.
I went to her and I said, "Hey, look at this." And she told me, "You should probably go get that looked at." And I am not at the age where I do routine mammograms. I am
Right.
below
You're
that.
very young.
Yes, I was diagnosed at 38. So
Wow.
it's not on my radar to be getting these annual, mammograms. So I went and saw my primary care doctor, got a mammogram. They did an ultrasound and ultimately needed a biopsy. And it did come back as malignant. And I was triple positive, which was a little scary, being HER2 positive. Already has some complications. And then you add, all the other bits to that, the being triple positive, and it just made it a little bit more complicated. So things started moving really fast at that point. I felt like it took forever to get a mammogram, and I didn't feel like my doctors were moving as fast as I would have liked. But then as soon as that diagnosis came back, I was like, oh my gosh, I don't even have a second to even process this. I was in an oncology office, and treatments were and surgeries were being scheduled. And so it was kind of a lot, but I was diagnosed with ultimately stage 1 breast cancer, triple positive, and kind of started that journey, which included a mastectomy, reconstruction, lots of complications, and chemo, and which I'm still in the middle of right now.
Okay. Yeah, it's amazing how once the diagnosis happens, everything just and I don't know if it's the combination of just this whirlwind of holy cow, I have this and everything's happening so fast, or if it just happens really fast and they want to get you in and get everything taken care of, or maybe kind of a combination of the two.
Right. Yeah, I
Yeah.
think maybe a combination of the two. I think it's always going to move too fast to try and process something like cancer, but you know we just have to take it a day at a time, I guess.
Right. And it is always a day at a time. And I am personally, I was diagnosed with triple positive breast cancer as
Okay.
well. So I very much understand the 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 scariness of it. And I mean, I think cancer's scary in and of itself. Like, you hear those three words and your first thing is, oh my gosh, am I going to die? And then it's, oh my gosh, what do I do now? Kind of thing. Yeah.
Yeah, for sure.
All right. So, like I said, you're still kind of in the process of everything going on. How is all that going for you?
It, I think the saying taking it a day at a time is very relevant there too. Every day is a little different. The reconstruction part has been one of the hardest parts for me, which was pretty unexpected. I really naively thought, oh, let me have the silver lining of this be a free boob job. But that was not the case. So
Mm.
that's been difficult, but my body ended up rejecting one of the sides of my reconstruction, and I ended up losing a lot of skin, losing a lot of my nipple and areola, and having to kind of just go through the process of healing that, then expanding, and then trying to put another implant in. So that wasn't the best. Chemo wasn't easy either. I did the DigniCap. I don't know if you did that at all, but I did DigniCap with my chemo treatments to try to save my hair. Um, they say you lose maybe
That's a
60,
cold cap.
70% of your hair. And yeah, cold cat, I think they're just different brand names. Mine was called Digni Cap, but
Okay.
yeah, it freezes your head, and it's awful. That was horrible. You're hooked up to that for 8 hours, and it's running while you're on your chemo. You have to start it before the chemo. You have to stop it after the chemo because it has to kind of close everything off. And I ended up it was so difficult to do that chemo cap and so painful with that Digni cap that thankfully my oncology office let me be sedated during that. So I would just passed out and did my first 12 rounds like that. And now
Oh,
I used to go every week for chemo, and now I'm going every 3 weeks. So I have a total of a year of treatment. And Tuesday, so 2 days ago, was my last round, and I'll have one more as my final round. So I'm really close to the end with my treatment. So I can't wait till 3 weeks from now. I'll be done.
oh, congratulations. That's so amazing.
Yes, I'll have that and one more surgery for my reconstruction. Hopefully, that'll be 5 surgeries. So, which I think for most people is one surgery. So.
Right. Five surgeries, so probably like a little over a year, right? For
Yes.
five surgeries.
Yeah, it's been a lot. So I can't wait to actually get my chemo port out at that surgery as well. It's been a nightmare having that port in for a year. It's just everything's uncomfortable, and it'll be nice to feel normal again.
Absolutely. Yeah, it's definitely a journey. And I do think that people feel, oh my gosh, yeah, and they'll just take the boobs out and put new ones in and, it'll be like nothing ever happened. And it very rarely actually turns out that way.
Yeah, no, it's definitely very noticeable, very different, but it's kind of the least of the concerns for me. But it's all part of the journey and part of finding out who your new self. What do you look and feel like now after going through this, and the aftermath, I guess, is what you're left with.
Absolutely. All right. So talk to us a little bit. So you hired a nurse for your clinic, but like you didn't hire her for oncology, you hired her for weight loss, correct? Or did you
No,
hire her for both at the time?
No, she's an aesthetic. So I have quite a few medical professionals that work at our medical spa. So she is an aesthetic nurse as well as
Okay.
an oncology nurse. So she does split her time between both professions or both fields of nursing. She's been doing aesthetic nursing for a very long time. So, if someone's going to come in, and I originally hired her for things like Botox and fillers and IVs and, all the aesthetic fun things. And
Mhm.
we really connected on this breast cancer journey because she's also been diagnosed with breast cancer not only once but twice. And
Wow.
she was the first person I told when I got this diagnosis. I remember getting, I think it's horrible the way that I found out, I got an email saying your test results are back. And, you get them before your doctors even reached out to you. So I open this, email and look at these labs. And for my layman's, I'm not a nurse or a medical professional. So when I'm looking at it and I see the word malignant and carcinoma in there, to me, I'm like, well, that doesn't sound good. But I was at my office in the spa, and it was just it's funny how things happen, the timing and where you are and the people you're with in your life, because there was no one else in the spa at that time. And we're so busy and there's always something going on and phones ringing. It was just, I just remember it being so silent. And I had texted her earlier, but she came in and she just said, can I give you a hug? And she walked me through what it meant. And I just remember crying in her arms. And she was one of the first people that knew about it and told me it was going to be okay. And it will be okay. So that makes me emotional to talk about. But we then became very focused on, for me, I didn't want to, I'm a very private person, so I didn't want to allow this to kind of consume my whole life. I have
Mhm.
a sibling, my brother has bone cancer, and I remember growing up watching him, what I felt like was just deteriorating in bed. And it just took over everything, his mental and physical self. And I didn't want that to happen to myself. And so I was very adamant that I was going to continue my life and all the things that I do in it exactly the same unless I had to change something. I would go to the doctor's office and they would tell me, you can't have those nails. You need to take your hair extensions out. I'm a very, bougie girl, I guess. That's why I have a med spa. So I've got, all
Right.
the fun stuff, the extensions and the nails and, the eyelashes and all these things. And I just said, no, I'm not doing that. I'm going to do me. And I'm good. And
Did
I
they
did.
say why that you shouldn't have those?
I think it's just precautionary, and almost feel like it's more of just like a canned statement. But again, I'm not a medical professional, so I could be totally wrong. But I just decided
Either.
I'm going to do me, and if something changes and I have to kind of start adjusting things, then I will. But I want to look and feel the best that I can, and part of feeling the best is trying to not look like a cancer patient. And I wanted to control who knew I had cancer and who didn't, and not walk in the door to a room and somebody look at me and go, oh, that person looks sick. And that was really important to me. So that's where the oncology department at my business really came about, was because I was going through all of this and I needed to feel better and I needed to try to feel and look my best. These different things started evolving. We offer a lot of IV therapy here. Well, one of my nurses was like, well, as soon as you're done with your treatment, we're going to pump you full of all these different IV fluids and all these things that can help replenish your levels and your white blood cell counts and all these things that start getting depleted. And that's what we started doing every week after my round. And it was life changing how I felt before I started doing that versus after I started doing that. And it started showing really in my treatment care at my oncologist's office. They always, every week when I see them, or now every 3 weeks, they go, I don't understand why your labs look so different than our normal cancer patient. why does your hair look so different? All these different things. And, some of these things I was doing on my own time and outside of my cancer treatments. And I really just realized people are not doing this. People don't know that they should be doing these things that can make them feel so much better, but also health wise be helping them receive their treatments so much better and have better results for their medications and their rounds and all of these things so that they are getting the most out of every bit of it.
Okay. And so now, I mean, I would imagine because you hear all these things, especially with chemo, like there are certain things that you shouldn't take. There are certain, like
Mhm.
to make sure that the chemo works and all of that. So, I mean, I'm assuming having an oncology nurse on staff, like they know, what things to do and what things not to do. And, are
Yeah.
there certain things that people shouldn't be doing, right around chemo treatments because it could affect the efficacy of the treatments?
There's a lot of things that you should and shouldn't be doing. It's a very, very important thing to be conscious of. So having somebody that's very educated in an environment like my medical spa is the key factor here. No oncologist is going to be like, yeah, just go anywhere and get an IV, start pumping stuff into you. I mean, that's just not going to work. So, it has to be somebody that is administering this and overseeing this and with a medical background that can speak to both. And so there are certain treatments and vitamins and things that you should not do. And they're even like as down to like a facial. There's certain facials that you should not do, or, lymphatic drainage. Like there's all these different things that you need to be conscious of. And having our medical staff that is so versed in both of these areas allows not only the patient to feel secure, but also that oncologist, because our nurses can be speaking to those nurses. And it's now this combination of care. They're already speaking to the plastic surgeon, to the, general surgeon, to radiology sometimes. And now they can speak to another person in that same oncology background. But now we can discuss, how can we make this patient feel much better outside of your oncology office, and they can have this planned continuous care, and the oncologist now can feel safe and secure knowing that their patient is going to have sterile access if they're having their port accessed, if they're whatever is in those vitamin bags and is appropriate for their type of cancer and their treatment course. So that's what really makes my medical facility totally different.
Okay. And then I guess that was going to be my next question. So is care for each individual who comes in like individualized? Do you have certain packages of, like this cocktail versus this cocktail depending on where they are in their treatment, or like how does that work? Because I don't really know much about, IV treatments for just feeling better.
Sure. I mean, there's so many different treatments we offer here, but for somebody that in this type of situation, but IV is a great one that to use for all kinds of different things. So whether they're at the end stage of their treatments and maybe now they're focused more on like hair regrowth, or some of those aftermath things, then there's vitamins that are going to speak more to that. Maybe during their treatment they're struggling with nausea or weight gain or weight loss. I gained 11 pounds when I was on during my first part of my chemo, while most people lose weight. I was having an allergic reaction to one of my medications. I still do every round I go in. So, do we have to speak to that? Are you having muscle aches and joint pain? That's a big one. So there's different things that we can be putting in their bags based off of what they're feeling that day or where they're at in their treatment, so that it's really customized. There's not a one size fits all in anything, in the aesthetics world, let alone the medical world. So every person's coming in and they're speaking to that medical provider, and we're really diving deep into what's going on, where are you at in your treatment, how are you feeling, and how are we going to either help you feel better or keep you feeling better, whichever applies.
And then do you normally recommend, IV treatments after every chemo treatment? Do you have kind of a protocol as to how often they should be getting them?
My oncologist said to me, we're putting the chemo into you, and your job is to get it out of you as fast as possible. So
Oh,
I
okay.
think that journey can be different for everybody. But for me, after I get an IV back every single week, and I started doing it every week because I was doing my chemo every week. But
Okay.
now that my chemo is spread out every 3 weeks, I still do it weekly because I mean, the tiredness, the muscle pains, the joint aches, the allergic reaction, the nausea, and that fatigue, that all sticks with me the entire time. So it's flushing that out of me as fast as possible and helping me keep my white blood cell counts high so I'm not getting neutropenic. And so for most patients, that weekly protocol has been great, but it's going to be their journey and what feels good to them. And it's really customizable.
Awesome. Okay, so other than like outside of the IV treatments, what other services do you have, for people in your oncology department?
Our oncology department is very vast. So we have so outside of the IVs, they can do things like maybe they lost all their eyelashes. Like for me, for example, I don't have any top or bottom eyelashes right now, but I look like I do because my lash department put top and bottom eyelash extensions on for me. Or maybe they need certain medications, like Latisse is a popular one where we can regrow those eyelashes. So, some other areas would be like permanent, like the tattooing, areola restoration, for example. I'm going to have to do that once I am finished with my treatments. But some patients completely lose their areola and nipple, so they need that 3D tattooing. There's certain oncology facials that clients can do that really help with some of that lymphatic system, but also just making you feel better. Or if you're having a reaction like I was having, I was getting, I have to take an antibiotic now every day while I'm doing my chemo because I'm allergic to it. But I was getting these welts all over my body from my face all the way down through my torso that just were these pustules and just these sores, and they're disgusting. So with our skincare, we have prescription grade skincare here that can be as extreme and potent as somebody might need, maybe somebody that's not going through cancer treatment, and then also as gentle as somebody needs. Like in my situation, needed very specific types of ingredients that were going to help me with these reactions and what my skin was doing based off of my chemo. Um, so lashes, hair regrowth. So I lost a lot of my hair even with the Digny cap. So now I'm trying to regrow a lot of that. So PRP treatments where we're taking your blood and we're spinning it and we're taking that plasma out and we're injecting it into your scalp. That helps regrow hair very quickly. We also offer medications that can help with hair regrowth. So that's very popular. Um, we have so many different areas that somebody could benefit from when they're doing this journey, going through this journey.
Do you do microblading? Like, because I know people lose their eyebrows as well, and
Yep, mine are tattooed on, permanent makeup, permanent cosmetics. We do all of that. That's a great example of a service that we need to be very specific about when we do it. That's not something we're going to do for a patient in the middle of treatment. We're going to wait till the end to help them with that,
okay.
or before, one of the two. But we absolutely can help them with that. And I was grateful that I had done that before because when I lost all my eyebrow hair, I still had something there.
Yeah. And so a few months ago, I interviewed a woman who is a hairdresser, and we kind of talked about this, and you know, getting extensions and things like that. And I always want to say, because there are people out there that are like, "Oh my gosh, that's just vain," and "Why do you care? You're going through cancer and stuff." And maybe you can speak to this a little bit, but we really talked about how important it is for people going through this to be able to look in the mirror and still kind of look like themselves or feel like themselves, or like you said, you don't want people to look at you and say, oh my gosh, that's a sick person, or and that's a person with cancer. So do you see a lot of that in your clinic, and just how important it is for your own self-esteem, self-confidence, like just to feel like yourself?
I think that's been the biggest part of my journey, to be honest with you, because your morale and how you're doing mentally is going to really make a positive or negative effect on how you're responding to your treatment. I strongly believe that. I saw that with my brother when he was going through cancer treatments, when he was not in a good mental headspace. He did not respond to his medications well. Things really regressed. When he was in a good mental state, it was night and day. And I really remembered that going into my own treatment. And it was really important for me to try to do whatever was possible for me to keep my morale the same. And I also really did not want to, I was very conscious of how my diagnosis was going to affect my family, my children, my employees. I had just opened this business and hired all these people. The last thing I wanted was for them to be like, oh God, is this lady going to die? We should probably go find a different job. Or my young children, they're 19 and 20 right now, but I wanted to show up as my best self for them so that they looked at me and, thought, okay, mom's doing okay. She looks the same. Maybe not exactly the same, but, she's looking as normal as possible. I wanted to keep everything as status quo as possible. And it's made the biggest difference in my journey, because if you look good, you feel good. And when you feel good, you're in a good morale and you're responding better to treatments. And it's just this cycle that they all work and are intertwining, and it's so important.
Okay. And so, like I said, do you talk with your clients about that too, and help them? Because, I know a lot of people come in possibly and think, oh my gosh, I'm just being vain. Like this really isn't important in the grand scheme of things. And, do you see a lot of that with your clients or patients too?
To be honest with you, I don't hear a lot of that. I don't.
Okay.
It's somebody that talks about it being just a vain thing. I think that's a really naive and insensitive, perspective. Probably somebody that does not have cancer. If somebody does have cancer, that they're not feeling self-conscious or guilty about trying to feel and look as normal, whatever their normal is. We're every day you're just trying to survive. And if getting um my eyelashes on so I look like I have eyelashes makes me feel good, I'm going to go do it, and it's going to make a big impact in my life. So I haven't had anybody with that type of guilty or feeling of vain. It's more of, people being appreciative that there is somebody and a place that understands what they're going through. Because some of these people, our patients, don't really want to talk to everybody about this. And they don't want to, they don't know who to speak to about it. They don't know, does anyone get what they're feeling? And then they come into our medical facility and they're like, oh, these people get it because we are living it and we have lived it. And so they don't feel that way because they're just feeling welcome, and they feel safe to talk about as little or as much of their journey as they want to. And we're not going to judge them on that ever. We're going to help them feel the best that they can.
Yeah, it's amazing the difference, um, when you know that somebody that you're interacting with has been through cancer, or just and understands that. It's like I say all the time, it's like this club that nobody wanted to join, but there's just something about it that you're going to talk to somebody differently when you know that they've gone through a similar experience versus somebody like, if Joe Schmo was to open up a med spa with oncology and had never been through anything like this, it's going to be a very different experience than, hey, I'm with you guys. I'm going through this myself, and that the walls come down with people, and they just feel more open to sharing and talking about things when they know somebody else that they're talking to has been through it.
Well, and it's that level of sincerity. One thing I've always been very conscious of is I don't ever want somebody going through their cancer journey to feel like they're trying to be sold something. That's something that's very important to me. We want them to feel supported and listened to and heard. So when they're coming in, because I'm currently living it, a lot of my staff has lived through it, they um it's a different perspective, like you just said. They're not it's you can't meet people at this place in their life if you haven't gone through it yourself. And this department, this medical spa already was in existence, and we were doing all these different things, but the oncology side of it really became um, born because of that journey and that need that we were uncovering. And it really became a natural progression in our facility versus just like, oh, this sounds good. That can make some money. No, we actually give pretty deep discounts to our active oncology patients because we want them to be able to do these things. And I know how expensive this is. I mean, my other profession, I own an insurance brokerage. I get it. Not only am I living through it, I know the insurance side of it. And now, I'm saying, hey, on top of all those bills, come do an IV or come, do whatever. And, it's a lot. So we want it to be accessible. We want it to be safe and feel comfortable, but also to be affordable. That's why we accept HSA and FSA payments for patients, because that allows them another way to hopefully add these things into their protocols and their treatment plans so that it all works together.
Gotcha. And now, do you have any other? Because I would assume as you're going through your journey, you're seeing like, hey, this would be a good thing to add, or this is something that I want, so this would be a good thing to have because I'm sure other people want it too. Do you have like other offerings that are kind of thinking up and thinking that other people will want? And can you share any of those?
Yeah, we are always growing. We have a lot of exciting things that some of which I cannot share, but one that is really popular, and again would be based on what type of cancer someone has and the stage that they're at in their treatment. But hyperbaric chamber, that's something that I did after I did my reconstruction and I started having all of this necrosis on one side. So my skin was literally dying, and my doctor said, well, there's no treatment. The most we can do is try to stop it from getting more invasive. So go do hyperbaric chamber treatments. Well, my insurance declined it, and it was $35,000 for me to do out of pocket.
Wow.
So if I went through the hospital. So that was not an option that I did. But I'm sitting here with my skin black and dying. What am I going to do? So I found the next best option, which was hyperbaric chamber offerings that were outside of the hospital. So that means that the pressure is slightly different, but I did a lot of research to find, options that were as close as possible of what I would get through the hospital grade care. And when I narrowed this down, I realized there's like hardly any places to go. I was driving across town about 45 minutes, and you go every day. And so it was a huge battle. So I quickly learned that this was a great treatment, not for so many reasons, but it helped stop that necrosis and helped with the healing and that blood flow. It was phenomenal. So we will be adding a hyperbaric chamber, which is nice. And we also, it's not a service, but the other thing is all of the stuff you need when you are going through chemo treatment or, this oncology treatment. So whether it's the like the gloves you put on your hands to freeze your hands and your toes while you're in chemo. Maybe it's just the different pillows when you're laying in bed, after surgery, or the different belts that hold your drain tubes, all of these little items that you kind of purchase and have to get prepared for, it can be expensive. But then when you're done with treatment, you're like, I don't want to keep all this stuff. Like, what am I going to do with all of it? So, one thing I've been kind of wanting to launch is kind of this check in, check out of some of these supplies that patients can, kind of like a library system. Oh, hey, I'm going to have surgery and I'm going to need something like that. Hey, we've got one. Patients can bring stuff they're no longer using, and other patients can now kind of check them out when they need it and check them back in when they're done. So I just remember getting so many things from people, and some of them I never used, or I got multiples of, or I used and they were very helpful, and somebody else can benefit from that. So just even little things like that can make a big difference for patients feeling supported.
Oh my gosh, I love that idea. Because yeah, I mean, once your drains are out, the last thing you want to keep is that belt or
Mm-hmm.
that vest or whatever. You want it totally gone and just kind of forget about that. And yeah, and what do you do with it? So I loved being able to gift it to other people and so everybody can have it because that does stuff does add up. And I know like a lot of organizations that are out there that are they give those things away and stuff, especially pillows and things like that. But not everybody knows about that. So having that as a service is just beautiful.
Yeah. So we're trying to give back wherever we can.
I love it. So tell me, and again, you're still kind of on your journey, but if you had like one piece of advice to someone who's was just diagnosed or kind of just starting on that journey, and it could be about anything that you've experienced, what is like one piece of advice that you would give to somebody who's kind of just starting on this whole cancer journey?
That is a tough question. And when you were saying it, it made me emotional um, for whatever reason.
We
I
get a lot of
think,
unsolicited advice when we're going through
yeah,
cancer. And it could be something to not say to somebody or something that you experience that you want to pass on or it could be anything.
I think the biggest thing is just giving yourself that grace. There is a lot of people that want to help and be helpful, and not everybody just not people don't know what to do. We all want to support each other, but what does that look like? And if you're not feeling, I was talking to someone the other day about someone wanting to drop off food. Such a great gesture. And then for me, that could be some days very overwhelming where I'm like, oh my gosh, I don't want to have to feel like I'm entertaining somebody that comes by to do this nice gesture. And so, for me, just learning to be able to feel okay with saying, could you just leave it on the porch? Thank you so much. Like even just that, or telling my husband, can you go deal with that? Because I felt like at the beginning, like I had to have that conversation for those people, or I needed to show up, and sometimes I just couldn't show up as my best self, and I needed to be able to just hide away and just be laying in bed or doing whatever, or not talk about how I'm feeling that day because I just didn't want to. So I just think that grace of allowing yourself to go through this process, because some days are going to be really hard and some days are going to be just fine. So, just knowing that it's going to be up and down, and just allow yourself the grace to go through the process.
Wow, I love that. It's something that I never thought about. It's like, yes, can you just leave it on the porch or something so I don't have to entertain you? That's wow. That can be very powerful. Um, yeah. Oh, I got goosebumps about that. That's fabulous advice. Right?
Thanks.
Um, all right. So Lauren, where can people find you if they want to find out more information about your spa, about your oncology services, or just connect with you? What's the best way to do that?
Yeah, so I would say the best way to connect with the spa is either just come on in or find us online. So we are in Parker, Aesthetics 360 Lash and MedSpa. Like Parker Road and Hilltop are our two major cross streets. We're right behind Gunther Tootie's that just opened. And then our website is www.aesthetics360medspa.com. And
Okay.
then
And we'll
we
put
are
that in
also,
the show notes.
Yeah, we're also on Instagram at Aesthetics 360 MedSpa. So Instagram, we put a lot of our before and afters and a lot of kind of updates, but those are the best ways to get a hold of us and to learn more about our departments, or to get in touch with me.
Awesome. All right. Yeah, and like I said, we'll put all of that in the show notes so people can contact the spa if they're interested in learning about more of your services. So, well, thank you so much for taking this time with me today. This was a wonderful conversation, and I love all the things that you are doing at your med spa, and for other people who are going through this, who really just want to feel like themselves, and they want to they want to get that energy back and all of that. And it's just so important going through this kind of thing to really just feel like yourself as much as possible.
Thank you so much for having me. It's platforms like this that bring so much power to, spreading this word. So I'm really honored to be here, and it was a great time.
Absolutely. And best of luck with your last chemo treatment in a couple of weeks,
Yay!
and continued healing and being cancer free.
Yes, I'm so excited to be near
And
the
ring
end.
that bell hard when you are done.
I will. Thank you so much.
All right. Have a great rest of your day.
You too. Take care.
All right. Bye bye.